speak into that.
What I'm going to talk about tonight very briefly and hope to engage in some discussion with you about is the role of women in the mucky middle, because water is a women's issue in low and middle income countries. Not only do they provide the labor that brings water to families, to communities, and to institutions, but they also run huge risks in the process of getting water. Most particularly because my expertise lies in maternal and newborn care, and because I too know Jean Chamberlain, a fact that all of us at one point or another live to regret, because she sets a dynamo that you can't get away from it. We began to look at why women in low and middle income countries were dying at rates that are absolutely unacceptable in terms of maternity care. And they're dying of sepsis. So they're dying of infection. That's the leading killer of women outside of the developed world. Well, if you trace what sepsis is, it means somehow they're getting infections. So it became a fairly simple link to look at water and sanitation as a major cause of women dying in low and middle income countries. And somehow in this process of the mucky middle, we then said, well, what we should do about this is train more doctors and nurses. Now, I don't know about you, but my logic says if somebody's dying from an preventable infection, you don't train the people who can cure them, you prevent the infection from happening. But I have this strange sense of logic. So Jean and I began to work on programs that would help train some of her students in water and sanitation, and would look at interventions that could be introduced in mother-friendly hospitals to reduce the morbidity and mortality among women and newborns. The first thing you have to recognize if you look at women and water is that decision making means you have some power to implement a decision. In most low and middle income countries, women don't exercise the power that they have. You'll note I didn't say they don't have power. I just said they don't exercise the power. In order to exercise power, you have to be able to implement something, which means you have to have access to resources. And by and large in these countries, women can't access resources. I once did a talk here called The Tale of the Two Goats, and how women would have access to water if they actually owned the goats. There's power sharing in families that generally excludes women from having power over resources. Within the community, women often have no say in how resources are acquired or deployed. Now, interestingly, in Uganda, because of a woman named Maria Mutagamba, that some of you may have met, women are part of the water committee. And in order to have a water committee in those communities in Uganda, you must have women on them. So this has been a shift in the power relationship of women to water. In the districts, also under the district committee system, women are gaining more access over water and how it's used. But the other relationship that makes it even more mucky in the middle is the donor-recipient relationship. In low and middle income countries, water and sanitation is heavily controlled by the donor community. That's us. That's us who go in and decide that we're going to sink wells, and we're going to build pit latrines, and we're going to do whatever it is we decide we're going to do, often in the absence of any negotiation with the community, unlike the story that Tim's just shared with you. And then we wonder why 2 years later when we go back, our boreholes are dry and our communities are in at least as bad shape as they were before we went there. We go with good intentions, but we tend not to understand the communities with whom we are interacting. National standards and decision making also mean that women are often excluded. National standards have been largely driven by economic concerns. So the possibility of acquiring economic resources for a country has driven the standards of water and sanitation that they've allowed. He often says, I don't understand how come you can get Coca-Cola in any village in Uganda, but I can't get birthing kits to every village in Uganda. So the distribution for Coca-Cola, because it has power, has economic capital, is amazing. The distribution for birthing kits is far less evident. Transnational cooperation also means that we're often working at odds with each other. So we have one country going in, digging wells, and another country going in, taking them out and putting in new kinds of water facilities. It's amazing how much countries can't get themselves together to have a single kind of international perspective on how you improve water and sanitation. Centers of power are generally, in the countries we're dealing with, top down. So when I go to Uganda, it makes absolute perfect sense to me that Jean has the wife of the president as the patron of Save the Mothers, because the decisions are top down about how money is going to be spent. There is nothing about a community that tells you how you're going to spend money. Then there's a question of power over what. If a community wants to build a good water cleaning system of some kind, that's fine as long as it doesn't interfere with whatever business is doing in that community at any given time. So if you've got a clean water generating plant going in and the fishing company decides they really need to gut fish at the end of that pier, which is only 500 meters from your water intake, guess who's going to win? Women not being engaged in many of these countries in anything like medium to large size industry means they're even more disempowered for making decisions over water and sanitation. Then there's the cost of who bears the cost of all these changes. Local communities can bear many of the costs for small improvements in water and sanitation. But if you're talking about the cost of cleaning up a river, moving an intake pipe, small communities cannot afford to do this, and women have no control over how money is spent in small communities. So there's nothing comparable to the city council where you can argue it out. So if they say what we really need is water to the school, people say that's nice, we really want water for something else, and women don't have much say in that. The cost of not improving water and sanitation is largely borne by women in low and middle income countries. They are still the water fetchers of the world. So before you go to school, by the time you're 5, you are walking 2-3 kilometers to fetch water and bring it back. That's before school. Then you'll do the same thing again after school. If you're a grown woman, you'll do that several times a day just to get enough water for the use of your family, let alone any work, other kinds of work that you might do. The end is simply to maintain what you've got at the moment. It's not that they can see an improvement. It's not that there's a vision that says, 5 years from now, my children will be healthy. 5 years from now, I won't have to cart water. 5 years from now, I'll be able to go to school. There's an idea that we'll make it to tomorrow. I will get the water to the house for today. So the vision is very short term. There's also a whole notion in many countries, Canada being among them, I would suggest to you, that people accumulate power for the sake of power. So sometimes the decisions are simply made so you have control over resources. They're not always decisions that are made because it's in the best interests of the community. Some of the interesting work that's been done in Aboriginal communities in the Northwest indicates that there's been no priority given to water and sanitation in those communities. We're learning lessons from the South that we can translate into Aboriginal communities in Canada about how to redistribute power and bring that power to bear on water and sanitation in Aboriginal communities. And there is a huge gap between regulation and practice. In Uganda, there are a set of regulations that have to do with clean water and the fact that you must provide clean water for communities. But the regulation there's nobody who inspects, there's no consequences of the regulations if they're violated, either positive or negative. So there's neither the carrot nor the stick. So there's this huge gap between the regulation and the real life practice. So you ask to be taken to a borehole that you know was put in, or no, I shouldn't say you know was paid for to be put in 3 years ago. And suddenly that day the car doesn't work. And the next day when you're to go to the borehole, the person who is the inspector for the borehole doesn't turn up that day for work. Or the third day when you go to see the borehole, the road's closed to get up to where the borehole is. There are an amazing number of reasons why you never get to see the borehole. The largest being that the borehole was never done. So you get this huge gap between what you think you've got and what you actually have on the ground. And one of the most interesting things to do is to talk to the women in a community, because they'll tell you whether there's a water supply that's closer or not, because they didn't have access to the finances to put it in the first place, and they'll tell you how far they walk to fetch water. From the bottom up, that is from the ground to the reality of women and water, we know that the health of women is being affected negatively by having to collect water. We know that the health of pregnant women is affected by having to carry 50 pounds of water a day. We have no randomized clinical trials that tells us how much that affects their pregnancy, but we do know that women have a higher rate of miscarriage where they're doing a lot of heavy lifting. We know that children are being deprived of education because they're out there collecting water. We know they're being deprived of education because they're getting sick with waterborne illnesses. We know that water is threatening food security, and that's clearly in these countries where women are most concerned about the health of their families in terms of food security, and the inability of women to participate in meaningful economic undertakings in their community because their days are spent fetching water. What we have tried to do is to begin to help women find a voice about water and sanitation, and have them deliver that voice to people like Tim when they're in town, and to water committees, and to international donors, and to government, to actually tell people what it's like on the ground to live without adequate water or sanitation. In the absence of adequate sanitation, girls leave school at around the age of 12 when they begin their periods because there is no safe place for them to be. So they lose any advanced education as well as education that they lose from water collection. We then are beginning to teach them how to use their voices. So we're starting to introduce a program, for example, at the Uganda Christian University in the first year about WASH and why it's important to every university student. So we're beginning to give those people who are going to have voices in a variety of ways the message that they can send out to their community. And as in Canada, there's a significant number of women who are going to that university, so they're going to be carrying the messages back to their communities. So we find ourselves still caught in the mucky middle. The middle that says we know what the policies should look like, we don't know how to implement them. We know what outcomes we should be getting, but we're not quite sure how to measure them because we don't have a strategy for working with small communities to improve their water and sanitation situation. We need strong cohesion in communities, largely led by women, I would suggest, that will bring about these changes at the local level. It will only work if it's bottom up. It's not going to work top down. And they're going to have to find their own actions that bring water and sanitation to their communities. Thank you.